Good afternoon, everyone, and welcome back to our regular daily 2:30 briefing. To kick off our conversation today, I'd like to call on Dr. Ezike for today's medical update.
Good afternoon, everyone, and hope people were able to celebrate the holiday that honors our nation's heroes, as well as maybe graduations, other special events in a MSD, masked and socially distanced kind of way. I want to mention that our numbers today, the cases, the deaths, the total specimens resulted, are today, as they typically are on the weekends, a little bit lower. And that's because medical providers, local health departments, laboratories may not always report everything over weekends. And we were fortunate in our state public health labs to actually give them a day off for the first time in months. So we will see the numbers pick up again after starting tomorrow. But since yesterday, we had 1,178 individuals that were diagnosed with COVID-19. That brings our statewide total of confirmed cases to 113,195. This did still include the report of 39 additional individuals who lost their battle with COVID, for a total of 4,923 deaths. As of last night, and these are actual numbers not affected by the weekend, 3,788 people were in the hospital hospitalized with were hospitalized with COVID-19, and of those 3,788, 1,035 patients were in the ICU, and 590 individuals were on ventilators. To date, 794 tests have been run, with 17,230 being reported in the last 24 hours. I see my role as one to share data and also to share ways that the public can keep themselves safe, but I'd also like to share some hope. And I do want to share that for the week ending May 16th, we reported out a total of 780 deaths. While 780 deaths, of course, represent 780 individuals who lost their lives, and families and loved ones and communities who are mourning those deaths, it still signals the first week that there have been fewer deaths than the previous week. And so I am hopeful that this fact is the beginning of a downward trend. But of course, that also depends on all of us and making sure that we're doing all that we can to decrease the transmission of this virus. Another good thing is that remdesivir, that is the investigational drug that has showed some important clinical outcomes for hospitalized patients, and that it decreases hospital stay. We did get a third shipment of remdesivir last week, and that involves 353 cases, and that has been distributed to hospitals around the state. Each of these cases has enough vials to treat approximately 5 patients, depending on the course of treatment that's utilized, whether it's a 5-day treatment or a 10-day treatment. And I know hospitals want to know how we determined where that medicine went. We looked at several criteria. We analyzed COVID-19 data provided by hospitals, the number of COVID-19 patients, as well as bed and ventilator use. Every hospital with at least one laboratory confirmed or probable COVID-19 case using a hospital bed between May 12th and 18th received at least one case. The remaining cases of remdesivir were distributed proportionally among the hospitals based on the number of confirmed or probable COVID-19 cases in their hospitals during that same time frame. Hospitals that may not need the remdesivir that they were allocated are free to share their allocation with other hospitals that can use the medicine for their COVID-19 cases. We will not be getting any shipments of remdesivir this week, but we are expecting additional shipment next week. It is our intention to make sure that every hospital that's treating COVID patients receives at least a case of remdesivir. And so if you happen to be a hospital that did not receive a case, please call the COVID line and let us know that. We will make sure that with next week's shipment that you are included. We are trying to make sure that this touches every hospital that's participating in COVID care. So while early studies have shown good results, this is still an investigational drug. We're learning that there are other drugs that are in the pipeline. This drug did show decreased hospitalization days, and so we are happy to have received this from the federal government and are happy for our hospitals to be using this in the care of COVID patients. But until we have a definitive cure and a vaccine, we must continue to protect ourselves from the virus and prevent further spread. I thank Governor Pritzker for his constant call for action to aid the people of Illinois. His call and his support of hospitals has given our state a great position as we take on this fight against COVID-19. So as always, please stay home, wear a mask when you are not at home, and keep 6 feet of distance between you and others. Let's continue to keep up our fight against this pandemic. Thank you. And I will now summarize comments in Spanish. Buenas tardes y espero que disfrutaron el fin de semana en una manera saludable y con distanciamiento social. Quiero mencionar que nuestros números, los casos, muertes y muestras son típicamente más bajos los fines de semana y algunos proveedores médicos, departamentos de salud locales y laboratorios pueden no reportar durante el fin de semana, lo que significa que los números que vemos después del fin de semana son elevados. Desde ayer, 1,178 personas han sido diagnosticadas con COVID-19. Ahora tenemos 113,195 casos confirmados en total en Illinois. Lamentablemente, esto incluye 39 personas adicionales con COVID-19 que han perdido la vida para un total de 4,923 muertes. Hasta anoche se informó que 3,788 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,035 pacientes estaban en la unidad de cuidados intensivos y 590 pacientes estaban en ventiladores. 17,230 pruebas hechas fueron reportadas en las últimas 24 horas. Illinois recientemente recibió su tercer envío de 353 cajas de remdesivir y los ha distribuido a hospitales por todo el estado. Cada caja contiene suficiente medicina para tratar aproximadamente 5 pacientes, dependiendo en el curso del tratamiento. Hay algunos factores para determinar la distribución de remdesivir. Analizamos los datos de COVID-19 de los hospitales, el número de pacientes con COVID-19, también la disponibilidad de camas y ventiladores. Cada hospital con al menos un caso COVID-19 confirmado o probable por laboratorio que usa una cama de hospital en algún momento del 12 al 18 de mayo recibió al menos una caja de medicina. El restante de remdesivir se distribuyeron entre los hospitales en función del número de casos confirmados o probables de COVID-19 en sus hospitales durante ese mismo periodo de tiempo. Esperamos futuros envíos de remdesivir. Los primeros estudios han mostrado buenos resultados. Debemos recordar que este sigue siendo un medicamento en investigación. Hasta que tengamos tal tratamiento o vacuna, debemos continuar luchando contra el virus y evitar una mayor propagación. Agradezco al gobernador Pritzker por sus llamadas para acción y ayuda para el estado de Illinois. Su llamada para tratamientos y apoyo para nuestros hospitales le ha dado a nuestro estado una oportunidad de luchar contra este virus. Quédense en casa cuando puedan. Usa una máscara cuando no pueda mantener la distancia entre usted y los demás. Estos son los claves para enfrentar este virus. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. Good afternoon, everyone. Again, over the weekend, my administration released our baseline health guidance for those industries that are eligible to begin their reopening in Phase 3 of Restore Illinois. While many individual businesses and specific associations have already developed more stringent guidance of their own, these protocols offer a minimum expectation of what operations should look like for these businesses moving forward. Anyone interested in reviewing this guidance or accessing business toolkits with signage and training materials can find them on the Illinois Department of Commerce and Economic Opportunity website. With that in mind, I want to briefly review where each region of Illinois stands in meeting the metrics to move into Phase 3 this Friday, and the overall direction of those metrics for our entire state. Phase 3 of our plan began May 1st, and especially over the course of the past 2 weeks, we have all watched the trends of each of the 4 Restore Illinois regions and measured them for the 3 metrics necessary to move forward: positivity rate below 20%, stable hospitalizations, and hospital bed availability above 14%. There is great news. All regions continue on track to move into Phase 3 by the end of this week. Statewide, the positivity rate, which hit a high of 23% in late April, is now averaging 9.2% for the last 7 days. COVID-related hospitalizations, which had been holding steady a couple of weeks ago, have now dropped to a 6-week low, with nearly 1,200 fewer beds in use by COVID-positive patients. And hospital bed and ICU bed availability are both above 30%. So as we look at each individual region, you see the same trends playing out everywhere. Instead of reviewing each individual region for you again today, all of the data for every region, which is updated each afternoon, can be found at dph.illinois.gov/restore. Again, that's at the Department of Public Health's website, dph.illinois.gov/restore. The fact that we've seen these numbers trend in a good direction, even after we opened things up in Phase 2, demonstrates the importance of everyday actions. Remember that one of the biggest mitigation measures was put in place at the same moment that we opened more things up. We required face coverings. Take note that along with social distancing, face coverings can make all the difference in protecting each other. And it appears to be working. Since we implemented that one change, we saw all the numbers that had already stabilized then begin to fall. A gradual restoration of more areas of our lives, together with the basic mitigations like social distancing, face coverings, and hand washing, taking greater care to consider public health in all that we do, are the keys to moving quickly through the phases of Restore Illinois. As always, all of our success thus far, and any that we have going forward, is dependent on the actions of each individual and all of us collectively to protect each other. Thank you, and now I'd be happy to take any questions from members of the media. Craig?
Good afternoon, Governor. Nice to see you again.
Good to see you.
Does it feel good to be back in your offices?
Well, I mean, it was great to be in my office in Springfield, that's for sure.
Quick question. The last time we were here was prior to the announcement of your staffer who was diagnosed. Can you give us a quick update on how that person is doing?
That person is fully recovered. That person is back at work. and doing just fine. So thank you for asking.
I have a list of questions here. A lot of them have to do with Alan Skillicorn this morning announcing that he was going to be going ahead with a recall affidavit for you, claiming you failed the state with IDES and you've overstepped your authority. Can you respond to that affidavit, first of all?
Well, I'm glad to hear that the representative apparently has changed his mind and now believes that we ought to fund state government instead of hollow it out the way that he has voted over the course of his career, because it is a fact that IDES and other agencies like the Department of Public Health have been, frankly, left behind after many years of representatives like that one voting to have a budget stalemate for 2 years in which we had no budget and no funding for our budget in the state, and has consistently voted against budgets that would fund vital agencies that we now, frankly, need very badly in this pandemic.
He's saying you were late to the ball game to respond and prepare for, knowing that your stay-at-home order was going to cause millions of people to be called non-essential and to lose their jobs. He said more should have been done sooner. How much of this problem do you bear responsibility for?
Well, I think what he forgets is that the stay-at-home order, which is very much like what's happened all across the nation, was a vitally important part of slowing down the transmission levels of COVID-19. Many, many fewer people have died. Many, many fewer people have gone into ICU beds or hospital beds than would have had we not acted quickly at the beginning. And in the middle of this, remember what Emily Landon, the doctor who stood here on the day that we put the stay-at-home order in place, said, which is, the consequence of all the work that we did is nothing will happen. And so, yeah, I understand his point. His point is that now that you see things, I assume that he wanted the stay-at-home order at the beginning, although he never has expressed that.
I think what he said today was, in effect, that you should have anticipated so many people were going to be filing for unemployment, should have done more with the website sooner, should have hired more people sooner to deal with what he says you should have anticipated was going to happen.
Well, you couldn't possibly anticipate that we would have a number of unemployment filings that was an enormous multiple of that which occurred during the Great Recession. Nobody expected that. Nobody knew, in fact, when this pandemic would begin to subside in any way. In fact, the pandemic itself has not, but the reaction of the people of Illinois has really kept people safe. So the IDES website was designed 10 years ago. We've talked about this. And of course, when it became clear that we were going to see a rush of applications, we acted as quickly as we could with a system that, frankly, you can't just snap your fingers and replace. You have to, as I have often said, you're building the plane while trying to fly it. And you're trying to fly it while putting 1 million passengers on board. An almost impossible job, but one that IDES has handled as best it could. Now, the number of people who man the phones, I have to say that there are federal requirements for the training of somebody who answers a phone because of the privacy considerations. And so we've only been able to grow that very modestly. We brought everybody that we could to the front line to answer phones. We've expanded the number of phone lines, put new systems in, so people are getting their calls answered at about the clip of 2,000 per day. And we continue to work very, very hard to respond to people who could not get their application filed online. But again, I want to say to anybody out there that has not filed for unemployment, that needs to file for unemployment, that your best bet is to go online. That system is now handling many, many, many multiples of what it could handle at the very beginning of this epidemic. And I want people to make sure that they get the unemployment benefits that they deserve.
My colleague Mary Ann Ahern followed up with that. Do you need to hire more people on the phone lines? In New York, they got help from Google to get their site up and running. Do more people need to be hired for the phone lines, and should another company be brought in to help with the computer system?
Well, as with New York, we brought in outside contractors as well, and that's why our systems are working so much better now than they were at the very beginning. And so I want to compliment the people at IDES working with outside contractors to expand that online capability. As I said just a moment ago, we're bringing people on as fast as we can, but again, with the requirements for, that the federal government puts on who can be on those phone lines, really managing incoming filings. What we've done is tried to offload the calls that aren't individual privacy consideration calls and try to either put them to people who are not trained at taking by the at federal government level to taking those filings, so they can take the kind of helpline sorts of calls, or when people go online, they now have the ability to speak with somebody online on a chat bot.
Over the weekend, first of all, so many people were out and about. My colleague Sarah Schulte is asking about this Memorial Day weekend. First of all, were you in Lake Geneva at all? And if not, did you at least see the video of all the people that crowded the streets around the lake there, as well as the Indiana Dunes? And what's your reaction to so many people? Most of these people are probably coming from Illinois, just ignoring all the social distancing we're doing here, going to these other states, and then coming back.
Yeah. Well, the answer to the first part of that question is I think you've seen me every day on camera with this backdrop or in Springfield for the last 75 days or so. I have not been out of this state for, I don't know, since before, sometime in very early March, before this pandemic hit, before we had a disaster declared in the state. So that's the answer to the first part of that question. In terms of people who are going and partying in, not wearing masks, leaving the state, doing things that are essentially against the rules here in Illinois, but okay in some other state. I just want to point out that I just read yesterday that there was a 16% increase in hospitalizations in the state of Wisconsin since the stay-at-home order was rejected by their Supreme Court, and a 30% increase in Milwaukee in hospitalizations. So I think that's an example of what can happen if people don't follow the mitigations that are supposed to be put in place, that are supposed to keep people healthy and safe. So I would caution people, look, nobody stopped anybody from traveling. That's never been the case. Anybody can travel. What we've suggested to Illinois residents, because we want Illinois residents to be safe, is to follow the same rules for yourself when you travel that you would have if you were at home.
Were you dismayed, though, to see these crowds like they were?
I am terribly dismayed, frankly. I think that, the challenge here is I want every resident of Illinois safe. I want them to keep themselves safe. They have the ability to do that. And so people who choose not to either haven't been reading the newspaper, aren't following the rules, don't seem to understand how dangerous this pandemic is. And I want to be clear to everybody that's watching and to all the reporters so that you can report it out. The pandemic is still here. Just because the numbers are moving in the right direction in the state of Illinois, that does not mean that the virus has gone away. It's still there. The reason that we're doing so much better here in Illinois than we would otherwise have is because people have worn face coverings, that people are washing their hands. They're doing the things to keep themselves safe that they should be doing and following the executive orders that I put in place.
Cisco Cotto with BBM Radio asked, some Illinois houses of worship have capacities of hundreds or even thousands. California is letting them reopen with capacity limits this weekend as long as they don't have more than 100 people at a time. Yeah. In which phase do you plan to allow houses of worship to be able to do the same? And to that point, have you asked IDPH to come up with guidelines for churches for when they could open?
We've done even more than that, Craig. We've asked churches to come with their ideas about how they can do it safely. As you've seen, we have allowed drive-up services. We are working with churches for outdoor services. We want people to be able to worship. I think it's vitally important. All we want to make sure is that when they do it, that they're safe. And so we'll work with any churches. We're taking plans from churches and trying to work with them. You saw that the Catholic Church came up with a very workable plan that I think is, a model for people to follow. So I encourage anybody that has an interest in putting forward a plan to do it safely, because I know the vast majority of faith leaders just want to do it right. They want to keep their parishioners safe.
Has IDPH begun the process of coming up with its own guidelines, much like it did with the legislature, for them to meet?
Again, yes, of course. Again, the Catholic Church, for example, came to us with their
I mean IDPH. I mean, they set the guidelines
Yes.
for the legislature to return.
Yes, I understand, but we can't write those until the legislature came to us and asked, how could we do it? And so we provided that. And the same thing is true of churches, mosques, synagogues. We want them to come forward. We want them to have their own ideas, what will work for them, because it can be different in different facilities. And then we want to make sure that IDPH, guides them in the proper way.
Darren Bailey's case was in court downstate. My colleague Mike Flannery just asked the U.S. Department of Justice, saying the stay-at-home order exceeded your legal power under state law, and that a state judge should handle this case rather than transferring it to federal court. No decision made on that today, but what is your take on that? What's your response to the feds getting involved last Friday?
Yeah, the decision will be made by a federal judge about whether the cases should go to federal court. But clearly those cases have as their basis some accusation that a constitutional right is being taken away. And so that's a federal matter if it's a constitutional right. So they're just wrong. I understand that that the Justice Department, which is very much under the political thumb of the White House, is encouraging their appointees to weigh in on things like this. It's a highly political thing to do, very unusual if you ask most people that have served in those capacities in the past. But that's what the White House has chosen to do.
Craig, we'll give you two more, and then we'll go online.
All righty. Thank you. Let's see. Heather Sharon with WTTW asked, the ban on evictions set to expire on Friday, along with your stay-at-home order. You've said that order will be extended to allow the state to enter into phase 3. Will a continued ban on evictions be part of that new order?
Yes.
Okay, well, that's quick and easy. Greg Bishop with the Senate Square. This would be for Dr. Ezike, who doesn't seem to mind sitting over there in the shadows, but this question was for you. What is the state doing to help fund COVID-19 therapies, and can you provide any update on antibody testing information that the state has, and why is that not being reported? I know it's a loaded question.
So the state itself is not the one that does research itself to identify. We don't have labs where we're trying to come up with the therapies. Once those therapies go through their normal process and then are FDA approved, of course, they'll be used throughout the state. So it's not really within the purview of IDPH. Your second question was regarding antibody testing. Yes. So yes, there is antibody testing that has been happening through the state. Again, I think as we may have discussed in the past, there's still a lot of questions out regarding the significance of the antibody tests. We know that we have a way to look and see if people may be developing antibodies. There are different types of antibodies. There's the IgG antibody, there's the IgM antibody, and so trying to figure out what level of antibody would then portend immunity, and if it does portend immunity, is it how long is that immunity for? So not being able to answer those questions, not having any reference standards that we can use. We can't do much with it now. We did convene a group of infectious disease docs, epidemiologists, immunologists, and virologists to review this issue and see if there was a more definitive role for antibody tests in the state of Illinois to help with the reopening plan. And that team of experts did deliver that report and said, at this time, we can't do anything with it yet, but we are hoping we will get to a point where it can have a more prominent role in decision-making, in plans, in determining herd immunity, et cetera.
Dr. Zike, this question is for you, so you just want to stay there. Regarding testing numbers, this is from WGN. Can you clarify the numbers? When we look at the number of positive COVID-19 tests, does that indicate the number of people infected? When people have multiple tests throughout their illness, are those tests counted in the total positive test numbers?
Okay, so if we're trying to get at, we know that certain people may have multiple specimens that were taken, and so if you want to have the positivity rate for people over people tested, total positive people over people tested total, that would give you, that would be comparing the same thing in the numerator and the denominator. And so we want to give how many people were actually positive cases over how many people were totally tested. And so that is the number that would that we're trying to give as the percent positivity. And so we're trying to make sure that that's what the data represents, and that's what we're trying to report going forward.
Okay.
And may I just say, it appears to be a very small number of people who are getting multiple tests. So it isn't like there's some massive overstatement of the number of positives, but it's very unusual for people to go get multiple tests.
Okay, this is from Rick Pearson, who was supposed to be our pool reporter today, so I have quite a few from different reporters from him. There seems to be some confusion over how the state can move from stage 3 to stage 4 regarding the issue of contact tracing. What is the contact tracing metric and standard to go from stage 3 to stage 4? You previously said with a significant increase in testing for COVID-19 in the state over the past month, short of 30% of known cases in the state are a part of the contact tracing effort. The goal is more than double that to the industry standard of over 60%. The plan says begin contact tracing and monitoring within 24 hours of diagnosis for more than 90% of cases in the region. Is there a distinction between starting contact tracing at 90% and finishing it at 60%?
The effort is, and it's really, the effort is to the contact trace. Remember, we talked about percent, 100%. It's because there are quite either you can't come refuse traced, and they won't be forced to do it. But that's it is something above 60%. So we of those. Look, the point of the metro to set a goal for ourselves to significantly increase contact tracing, and we are doing that. We are currently working with the infrastructure that we have, building upon that. Today, I know that the city of Chicago talked about what their plans are. As you've heard from us, we're working with SIU and with St. Clair County and with other counties, and Lake County as 2 test beds for us. And then, of course, we have 102 counties, including Cook County, to work with. So we're going to continue to build up our contact tracing, but as long as we are making aggressive efforts to increase it, that, frankly, our goal here would be to get to 90% of the possible cases to contact trace.
Brian at the Southern Illinoisan, Hidden Lake Winery in Aviston, Illinois, announced they will not be requiring their staff to wear masks because they can be a, quote, reservoir for COVID-19 particles and, quote, create a false sense of security and risk our staff and guests' health. Are there any kind of special precautions or considerations wineries across the state should be considering as they move into phase 3?
So I think an important point to mention there is that if someone is wearing a mask, again, the primary goal was that you were not expelling virus. So if someone was wearing their mask and they were at a place of business, an establishment, and they thought that they were spewing out virus, that would suggest that you thought you had infection and were not staying home and were risking spreading that. So I would say that as a first word of caution, I would say if you think you are ill or you have signs that you are ill, you should be staying home in the first place and probably shouldn't be at any place of business. But then in general, when people are asymptomatically transmitting the virus, we know that if there are 2 people, if one person has the virus, if they wore a mask and this individual didn't, there would be a lower transmission, lower risk of spread because this person had a mask. If both of them were wearing a mask, there would be an even lower risk of spread. If both of them were wearing a mask and staying socially distanced at 6 feet, even lower. So we know that each of these measures are additive and help decrease the overall risk of transmission. And so I think all of our goals should be to decrease transmission because, in fact, despite even having a negative test yesterday, you could be positive today. And since we don't know and we're seeing that there's a growing amount of asymptomatic transmission, we should all be employing every tool at our disposal to decrease the possibility of transmission.
And this question is also for you, Dr. Ezike. Do you recommend self-quarantining for anyone who visited Lake of the Ozarks over Memorial Day weekend? It's a popular destination for folks in the Metro East, and some Missouri counties in Kansas have issued a self-quarantine recommendation. That's from Kelsey Landis at the Belleville News-Democrat.
No, and again, I would just say that that is some of the risk that we all are subject to as things start to open up. Things will, I think the whole state is going to evolve into phase 3. And as you think about going for that haircut, you don't really know where, people helping you or other people in the shop, you don't know where they have been. And so, yes, I would love if everyone around me who thinks they have been in a high-risk place, could stand down, but it's probably not going to happen. But the least that we can do is to wear our mask and promote the social distancing so that if someone does have something, we can decrease the amount of transmission that would be possible to the best of our abilities with the techniques that we have available to us.
Jim Leach at WMAY. Since both an administrative rule and proposed statute to tighten enforcement have failed to advance, are there any real teeth to your emergency orders? What will the state do to those who violate the orders?
Yeah, well, we're left with the enforcement mechanisms that we have or any rules that we may put forward going forward. But as you know, I talked about this, we've tried to avoid using those other methods of enforcement. It includes taking away people's license to do business. It includes the possibility of closing a business. Those are not things that I wanted. In fact, I implored the legislature to give me a tool. Our intention when we put an emergency order forward was to have the ability, an emergency rule rather, forward was to have the ability to simply to issue a citation, which is a much lower level of consequence for people than having their license taken away to do business entirely. I then asked the legislature simply to pass something. They were unwilling. I think they abdicated their responsibility. A lot of them talked about, that they're a co-equal branch. Well, then you've got to take a co-equal level of responsibility when you're asked to, and they were unwilling to. So we're going to have to pursue whatever tools are available to us now.
Governor, when will you sign Takeout Cocktails? Are you planning any other measures to help bars and restaurants make it through the pandemic?
Yeah, I'm so glad that passed, and I hope to sign that as soon as it's available to me. As you know, it needs to be passed over by the clerk of the House and the Senate, and I'll sign it as soon as it comes to my desk.
Kelly at Block Club also had another question for Dr. Ezike. How can people safely expand their quarantine circle in phase 3 when groups of 10 are allowed? Can you hug grandparents? Should you only see the same family and friends?
I can't give anybody a COVID-free pass. As you expand your circles, obviously there's the additional risk of transmission because, again, we don't necessarily know who is harboring the virus and who isn't. So hopefully, if people are all being as careful as you are and they have used their mask and social distance to the extent possible, hopefully their risk is low. But again, the more you increase your circle, the larger that circle is, absolutely the more risk. But people have to learn to coexist with COVID. And so, I know that people have, done a really good job and they've stayed at home, and now as they're coming out, they will have to make these calculated decisions and assume a risk that they're comfortable with. So it's a risk-benefit ratio. Again, there's no way to know for sure if someone is harboring the virus or not, and that's a little bit of a wild card. And so again, you can do what you feel is appropriate. take all the mitigation strategies that we do have and employ those. Use your mask and keep your distance. And after that, that's the most I can offer. I can't promise anything after that.
Shruti at Bloomberg, Illinois is the only state so far that officially plans to tap the Fed liquidity facility. Is that because Illinois has limited options, partly given past financial decisions that led to almost no rainy day fund and resulted in higher borrowing costs?
Well, what I can tell you is that it was the decision of the legislature to not implement more cuts, and a common belief and hope, I guess, that the federal government will in fact offer support to state and local governments all across the nation. But look, I think everybody understands that in this middle of this pandemic, every state has lost tax revenue and had increased expenditures that are related to COVID, as well as some that are tangential but only occurred as a result of COVID. So we're going to need help. There's no doubt about that. And I think that was the reason the legislature did what it did. But look, they also did not cut as much as I think they probably could. And so I'll have to continue to look at the budget along the way they gave me the authority to do that.
Shia Politico, does the state have a backup plan if President Trump goes through with his plan to pull back National Guard troops who help with contact tracing and delivering food to nursing homes?
Does the state have a what?
A backup plan.
Yeah. Well, I mean, we're gonna need to make those deliveries. We're gonna need to make fill in what we need to. If the federal government is not going to help out by supporting our National Guard troops, we obviously have the ability to fund those or choose to fund those if we decide to. But either way, we're not going to let those services fail.
Rich Miller at Capital Facts. Could you explain what happened with the Cannabis Bill? There's some confusion about whether a deal had been made with the governor's office to move it forward.
No, there was no deal made with the governor's office. They just could not get it moved forward between the House and the Senate.
Noel Ford at WICS. When are the regions set to move into Phase 3? Governor Pritzker has said the earliest is May 29th, but that's before the extended stay-at-home order is set to expire. Will there be a specific time that businesses can open?
May 29th is the date. If all four regions, which look like they're on track, and again, barring some catastrophe in the next 4 days, I suppose, it'll be May 29th, Friday, May 29th, that we'll move into Phase 3 in all four regions.
Are we on a downward trend, Governor, by the way?
It appears that way, and I think, Dr. Ezike and I have been talking about exactly, looking at the numbers on a daily basis, looking at it on a weekly average basis. The answer is we seem to have come off the peak.
Okay. Christine Herman at NPR will be our last question. New York Governor Andrew Cuomo said May 10th that the state will no longer allow COVID-19 patients who are still positive to be discharged from hospitals to nursing homes. What is the current policy in Illinois, and is there any plan to change it?
Well, again, the idea here is to keep everybody in nursing homes safe and to make sure that nursing home patients have somewhere to go. And so nursing home residents do have the ability to go back to a nursing home, and and they have the, to the extent that they have not been determined to be entirely COVID-free, they would probably not be let out of the hospital. So we're going to be very careful about that. People have already come out of the hospital and gone home, and we have not seen transmission from somebody who has come out of the hospital and then transmitted it to somebody in their nursing home.
All right, thank you.
Yep, thank you.